Ntoroko District health officials are raising alarm over the growing cases of teenage pregnancies and early marriages among flood-displaced communities, attributing the trend largely to overcrowding and poor living conditions in the camps. More than 9,000 people displaced by floods are living in over 5 camps across the district, with some families of up to 10 members sharing a single tent. Health officials say the lack of privacy in those congested shelters is exposing them to early sexual activity and consequently teenage pregnancies and early marriages.
10-year-old Annette, not her real name. The consequences of life in the displacement camp have already changed her life. Annette, who lives in Butorwa Camp in Kanara Sub-County, Ntoroko District, says she became pregnant at the age of 15 after being exposed to sexual activity in the crowded shelter she shared with her parents.
We stay with our parents in the same house, in the same bed.
The man who impregnated Annette later disappeared, and months later, she subsequently suffered a miscarriage.
We don't have any job there in Lake.
With no source of income and little support, Annette says she later entered another relationship and became pregnant again. She's now caring for the baby. But Annette is not alone. Esther, also not her real name, was only 14 when she became pregnant. She says her experience was similarly linked to the conditions under which she lived with her family in the camp. District health officials say early marriages in Ntoroko now stand at about 24%, above the national rate of 20%.
And this is far beyond the national target, which is about 20% of the teenage pregnancies.
According to the acting Ntoroko District Health Officer Rod Wilson, the problem is more pronounced among displaced communities where poor living conditions and overcrowding continue to expose adolescents to risks.
People are living in a small tent where the entire family stay in that single small room.
The rising cases have attracted interventions from non-government organizations led by Faith for Family Health Initiative, through stakeholder dialogues and interfaith community engagements aimed at improving maternal and adolescent health.
But the ones you see in the background, like that small house, hosts over 10 people, a mother, a father, an adolescent, and a child. And when it gets to issues of conjugal rights, the parents don't care that they have growing young people who are also seeing and they are imitating what they are doing.